Dolphin Therapy is a reactive mattress system that creates a simulated fluid environment, enabling full immersion and envelopment, significantly reducing pressure, shear and tissue deformation. Dolphin Therapy has a wealth of evidence to support its effectiveness with the most complex and difficult to manage patients, including comorbidities or challenging scenarios as seen on screen. Dolphin Therapy is also available in various sizes to suit the individual needs of each patient demographic. Place Dolphin Therapy on the bed frame, ensuring the foot symbol on the mattress cover is at the foot end of the bed. Secure the mattress to the moving parts of the bed frame using the securing straps. When the control unit is in use, please ensure the control unit is switched to battery on mode. This is located at the bottom of the control unit by the power cord. The control unit should only be turned to storage mode when Dolphin Therapy is not in use. Connect the mattress air hoses to the control unit prior to inflation. Clip them into the air outlets at the side of the control unit, ensuring they click into place. Connect the control unit to a nearby power source before pressing the power button to turn from standby to on. This will change the LED from orange to green. Select the appropriate mode, choosing between bed for a Dolphin Therapy mattress and chair for when the cushion is in use. The Immersion profile on the control unit highlights adjustments being made to achieve optimal immersion. When the patient first gets onto the mattress or during repositioning, the line will be amber or red. This quickly changes to green when full immersion is achieved. Prior to patient transfers and other care procedures, select Auto Firm mode to inflate the mattress cells to their maximum. Auto Firm provides a firm, stable surface to avoid manual handling injuries for the caregiver and protect the patient from shear or frictional forces. Auto Firm will automatically switch off and return to therapy mode after approximately 15 minutes. Comfort Adjust allows the comfort level to be altered within a therapeutic window from soft to firm by using the up and down arrows. It is recommended that the Comfort Adjust is always level with the auto feedback where possible. If a patient is over 113.6 kilograms or 18 stone, moving the Comfort Adjust indicator to one LED above the auto feedback LED may improve comfort. Equally, if a patient is less than 45.4 kilograms or 7 stone, moving the Comfort Adjust indicator to one LED below the auto feedback may improve comfort. If the auto feedback is red at any point, it may indicate a manual adjustment of comfort is needed. To lock out the control unit, press the lock button to avoid any further adjustments being made. Pressing the lock button again will unlock and restore functionality. In the event a fault occurs, Dolphin Therapy will audibly and visually alarm. Press the mute button to silence the alarm for up to 30 minutes. A fault is considered to be either the pressure is too hard for more than a 10-second period, the pressure is too soft for more than a 30-minute period, a differential error between Comfort Adjust and auto feedback for more than a 30-minute period. If a fault occurs, please ensure the CPR valve is in the closed position. Ensure the mattress air hoses are securely connected and ensure the power cord is in place. If you are unable to resolve the fault, please contact Medstrom 24/7, 365 for technical and clinical support. Dolphin Therapy has a battery backup that can operate for 12 hours if fully charged. This ensures the patient receives effective therapy even during transport or in the event of power failure. The battery on indicator will illuminate when the AC power has been removed, for example during transport to indicate the control unit is now running on battery. The battery low indicator will illuminate when the battery backup is at the end of its charge life. Please note, at this point, the control unit must be reconnected to mains power. In the event of a cardiac arrest, the CPR valve is located at the patient's right head end of the mattress. Turn from the closed to the open position by aligning the arrows on the valve for rapid deflation. Please note, the paediatric Dolphin CPR valve is located on the patient right at the foot end. When Dolphin therapy is no longer required, please always remember to change the switch underneath the control unit to storage mode. Failure to do this may result in product fault.